Hello guys, my name is Dr. Naye and you're welcome to Tidbits. So in today's video, we'll be talking about halitosis. So what is halitosis? Halitosis simply means mouth odor or oral mouth odor. Now we've all had mouth odor at some point in our lives, especially the morning after breath. There is no one, especially when you don't brush at night, that has not had that, that subtle smell or subtle odor that comes from the mouth before they brush. So we've all experienced some amount of mouth odor at some point in our lives. But when we talk about halitosis being a recurrent issue in someone's life, then that is a problem. Now, halitosis can be termed as a temporary issue or as a chronic problem, and it can stem from the mouth and also stem from systemic diseases. There are basically two types of halitosis. You have the true or genuine halitosis, and that halitosis can be detected from the patient's breath. Second one is a pseudo halitosis. It's more of a psychological feeling of halitosis. So when that patient presents to the dental clinic, no one can actually get a whiff of any oral malodor. So sometimes it's more of a psychological issue than an actual issue. But in today's video, we'll be talking about the true or genuine halitosis. Now when it comes to the causes of halitosis, it's been said that 80% of the causes actually stem from the mouth, while the remaining 20% can stem from systemic issues or extraoral causes. For the oral causes, number one is poor oral hygiene. When you have a lot of buildup of bacterial plaque in certain areas of your mouth, they can actually lead to halitosis. If you have food particles stuck in between your teeth, or you have a cavity that actually allows food to trap within, the food particles can become rancid with time and then give rise to a foul smell. Another factor too is your tongue. If you don't brush your tongue properly, it can actually trap a lot of bacterial plaque, and that can lead to halitosis. Second will be gum disease. Now with gum disease, you actually have inflammation of your gum, and this results from the accumulation of bacterial plaque along the gum line. So when this happens, if you don't take off those bacterial plaque, over time they can accumulate, they harden, and then they become calculus or tartar. Now this calculus or tartar allows more bacterial plaque to pack on it and to accumulate, and so over time you have inflammation of the gum line. Now as this inflammation proceeds, you can have what we call pockets. Pocket is a space between the gum and the tooth. Now when these pockets are established, you can have food particles getting stuck, bacterial plaque getting stuck, and all this over time can lead to malodor. Number three is the diet. Now, there are certain foods that we eat that actually have their own characteristic smell. Things like onions, garlic, they actually have a very strong smell, a very pungent odor, that when you take them, people know that you have taken such foods. So if you are conscious of those things, you may either eliminate your taking of those foods or try to rinse with water so that you don't have such strong smells coming out from your mouth. Dry mouth. Dry mouth is also called xerostomia. Now, the saliva that we have in our mouth that is produced, at intervals actually has a cleansing action. So it helps to rid the mouth or the teeth of dirt or accumulated dirt over time. But when you have dry mouth, it means that saliva production is actually reduced or practically non-existent. And so what happens is that the bacterial plaque has enough time to to thrive in that environment, and as such you end up having malodor over time. Now there are several medications that can lead to dry mouth, so you need to find out if it's your medication that is causing it or find out if it is due to a salivary gland issue. Another factor is tobacco products, and this includes both cigarette smoking and also the smokeless versions. Now with tobacco, it actually causes dry mouth over time. So the issue of xerostomia will actually play in this. Another factor also is the fact that nicotine has a characteristic smell. So when someone smokes, you know that they have smoked. That is why most times those who smoke tend to pop in one sweet or the other just to kind of mask the smell of the tobacco product. But over time, it can actually also lead to gum disease. And the problem with tobacco products is when gum disease actually starts, because they don't tend to experience the gum bleeding and all that, it actually reduces blood flow to the gum. So they won't actually feel or know that they have gum issues. So when it comes to tobacco products, people need to be careful because of the inherent dangers it has. Now, other possible causes of halitosis if you have inflamed or enlarged tonsils. When your tonsils are enlarged, you can actually have some crypts or spaces where over time accumulated dirt can form what we call tonsil stones. Now those tonsil stones are actually filled with bacteria and they have a very nasty smell to them. So that's another factor to be considered. Another thing would be gastrointestinal issues. So if you have gastric reflux, you can have mouth odor from that. Then some systemic diseases like diabetes, uncontrolled diabetes, and some kidney issues or some liver issues can actually have their own characteristic smell, which can give rise to mouth odor. Now when it comes to the treatment options for halitosis, you need to know what the actual cause is, because when you know what the cause is, you can now know what the treatment would be. Now for the dental causes of halitosis, by the time you visit your dentist, a proper assessment will be done to know if you need to do a general gum cleaning or gum curettage or periodontal gum disease treatments, or even fill your dental cavities, because dental cavities, like I said, can actually become a well where food particles can get stuck and lead to rancidity. And when they become rancid, like I said, mouth odor can come about. So if you have pockets, gum disease, if you have dental cavities, all those will be taken care of at your dentist. Now for smokers, it will be advised for you to stop smoking, because that's the only way you can actually rid yourself of that mouth odor. Now like I said earlier, with smoking you have a risk of having gum disease. You also have a risk of having mouth odor. And you also have a risk of also coming down with mouth cancer. So this is something you may want to consider. Stopping the habit will actually be good for you in the long run. So that's something that you should consider if you are a smoker. Then for the non-oral causes of mouth odor, I think it would be best for you to visit your general practitioner, your medical doctor, your family physician, so that they can find out what the underlying systemic issue is and then treat accordingly. Okay, so I hope this has been helpful, but some tips that you can actually do is making sure that you brush twice daily, brushing in the morning and brushing at night with a fluoride containing toothpaste. Secondly will be to floss daily, especially at night, so that you don't sleep over with the food particles that may be stuck in between your teeth. Thirdly, if you smoke, try to stop if you can. It will be good for you. Fourthly will be to use mouthwashes, especially alcohol-free mouthwashes. It can actually help to freshen your breath. And then lastly, try to make your dental appointments at least twice yearly. We say every 6 months. So visit the dentist every 6 months so that routine dental cleanings can be done for you. And assessment, a general assessment of your oral health can be done so that if you have gum disease, if you have dental cavities, all this can be seen on time and then taken care of. So I hope that this video has been educative. Please like, comment and share, and I'll see you in my next video.